Hello there. Welcome to the Pre-Care Guide on Cannabis. The following video is meant to inform you about cannabis, including the different types and extracts, its effect on the body, the risks of frequent usage, and its uses in modern medicine. The term medical marijuana refers to using the whole unprocessed marijuana plant or its basic extracts to treat symptoms of illness and other conditions. The benefits of using marijuana as a medical product has been noted dating back thousands of years in many cultures. Because cannabis is often used recreationally due to its effects on the brain, there has been much debate regarding its value in medicine. So what is cannabis? Cannabis is a complex plant species that is commonly referred to as marijuana. The plant is also known as hemp, which can have multiple industrial uses, including the production of paper, clothing, and hemp oil. The two most biologically active chemicals in cannabis are THC, which stands for tetrahydrocannabinol, and CBD, which stands for cannabidiol. We will go into more details on these chemicals later. However, it is important to note that there are many types or strains of cannabis, which typically depends on the specific THC to CBD ratio. Depending on this ratio, some strains have different kinds of effects than others. For example, if a strain of cannabis has a higher ratio of THC to CBD, it's more likely to affect your judgment, coordination, and decision-making. So how does cannabis work? The cannabinoids found in cannabis connect to naturally occurring receptors on cells in our body called the endocannabinoid system. These cells are primarily located in our brain and nervous system, but also other various organs as well. Our endocannabinoid system allows our body to self-regulate in response to hormones our body produces. These actions include regulation of body temperature, appetite, energy balance, and pain control. They also have an effect on our motor coordination, memory, stress response, as well as numerous other biological functions. In addition to the hormones produced by our body, ingested cannabis also interacts with these specific receptors, leading to the various reactions. What is THC? The most common cannabinoid typically found in the cannabis plant is THC. Cannabis plants with high concentrations of THC have been used both medicinally and recreationally throughout history. The ingestion of THC can lead to intoxicating effects, but also serves numerous medicinal purposes. THC provides the following and potentially many other benefits, including analgesia, which means reducing pain, antiemetic, which means reducing nausea and vomiting, antispasmodic, meaning it reduces muscle spasms, reduce anxiety, and anti-inflammatory, meaning it reduces inflammation. It can also stimulate appetite and can work as a sleeping aid. What is CBD? Cannabidiol, or CBD, is typically known for its physiological benefits and non-intoxicating nature. CBD has become a topic of much interest in the research of cannabinoids, as it is mainly used for therapeutic effects rather than recreational use. Some of the benefits of CBD use include antiepileptic, meaning it can reduce seizure activity, anxiolytic, meaning it reduces anxiety, antispasmodic, meaning it reduces muscle spasms, and is also an anti-inflammatory, antipsychotic, and a mild analgesic, meaning it can help with pain. In places where cannabis is now legal, such as Canada, there is a growing trend of consumers using CBD supplements to self-medicate, and CBD products have become widely available, with CBD oils, capsules, and many other forms on the market. Because of this, it is important that consumers have access to information to ensure that they are making informed decisions. So what is medical cannabis used for? Given the benefits of THC and CBD in combination, medical cannabis may be helpful for some health conditions. This includes, but is not limited to, the following: nausea and vomiting from chemotherapy for cancer, low appetite and weight loss for people who have AIDS, muscle stiffness for some multiple sclerosis or spinal cord injury patients, and chronic pain, in particular nerve pain at the end of life. In certain cases, cannabis can even be used in addition to or as an alternative to opioids, thus reducing the risk of dependency. Cannabis is available as fresh, a dried plant, or oil extracts from licensed producers. They usually contain both THC and CBD, and they can be used in many ways, including the following, such as smoking it as a dried plant, brewing it into tea, inhaling it as a vapor, spraying it under the tongue, applying a preparation to the skin, or eating it in prepared foods or homemade foods called edibles. Risk factors. The use of cannabis products has several short-term side effects, including a dry mouth, red eyes, anxiety or paranoid thoughts, a faster heart rate, dizziness, drowsiness, nausea and vomiting, or a short-term memory loss. Cannabis users may also be at risk for more severe or long-term risks, including the following: impaired motor skills and the risk of driving under the influence. Don't drive or operate machinery after using cannabis, as it may affect your judgment, coordination, and decision-making. It can also increase your risk of being in a car crash. If you smoke cannabis, the smoke could damage your lungs. It may make you cough or wheeze and cause lung infections like bronchitis. There is a risk of addiction. People who use cannabis often and then quit may have withdrawal symptoms. These include anxiety, trouble sleeping, and intense cravings for the drug. Long-term regular use of cannabis may increase your risk of severe nausea and vomiting, called cannabinoid hyperemesis syndrome, or CHS. People who have CHS may feel very thirsty and have belly pain and diarrhea. Prescription use. As an intoxicating substance, cannabis strains with high concentrations of THC must be ingested and prescribed with caution. Generally, doctors will attempt to remedy their patients using traditional treatments before prescribing cannabis. If they do opt to prescribe cannabis, a full medical review and evaluation is necessary. In addition to a discussion about side effects and dosing, there will also be a 3-month follow-up period to ensure that the treatment is stable. Recreational use. Recreational use is now legal in Canada, and marijuana is available to the public in flower, edible, tincture, oil, and many other forms. Although this video focuses strictly about the medical purposes of cannabis, we do recommend that you consult with your healthcare professional even if you are using cannabis for recreational purposes. How can you reduce the risk of harm from cannabis use? Don't drive or operate heavy machinery under the influence. Don't smoke cannabis. Avoid using cannabis with alcohol or other drugs. Reduce the risk of medicine interactions. Know what you're using by obtaining the cannabis from licensed producers. Store cannabis in a safe place away from children. Protect others from secondhand smoke. And know when to call for help if you're having unwanted side effects. In conclusion, cannabis is a less intrusive method of treating various medical conditions. It is helpful to understand the medical properties and effects of cannabis prior to considering its usage. We hope that this video has shed some light on any confusions you may have had about cannabis. On behalf of the pre-care team, we hope this information will empower you to make the most beneficial decision regarding medical cannabis use.